Hope your week is off to a good start. Social distancing here in Korea has been lowered to level 1, allowing quite a number of high-risk facilities to resume business with stringent safety measures in place, though. We have more on that later on the program. First, a look at the latest numbers on the pandemic here and elsewhere around the world with our Kwon So-ah. Now, so I hear that there's been a surge in the number of imported cases here in Korea today.
Yes, Sunny. Almost 30 cases from overseas were confirmed, which includes 11 language students from Nepal. So we are unfortunately starting off the week with a rise in both domestic and imported cases, which stand at 68 and 29 respectively. And also, it marks the highest figure of imported cases since late July. And 9 of today's imported cases were reported from the nation's airports or seaports, while the rest of the others were confirmed during the self-quarantine period in the nation. And with those combined, the capital Seoul confirmed 31 cases this Monday, followed by 29 in Gyeonggi-do province and 3 in Incheon, so more than 60 here in the metropolitan region alone. We also have 13 cases in Daejeon, and that includes infections among family members, which could have occurred during the Chuseok holiday. So with that, we have 97 new cases this Monday, raising the total to past 24,700. 433 is the death toll, and some 1,500 people remain in quarantine, while we also have over 22,700 people who made a full recovery from COVID-19 here in the country. And now let's move over to our graph here. We do see that in the past week, we only had a triple-digit figure on Wednesday, and apart from that, the numbers do look pretty stable in the double digits, but we do see quite an on-day rise from Sunday to Monday. And what we have to mention is that it's usually on Mondays when we do see lower figures due to the lower number of tests conducted over the weekend.
Right, so which is reason enough for authorities here to be on high alert, especially as Korea is back to level 1 social distancing as of today. Please tell us a bit more about the eased guidelines.
Sure, Sunny. The main rule of no more than 50 people indoors and 100 people outdoors has been lifted. But detailed guidelines have been introduced, such as allowing just 1 person per 4 square meters. And while high-risk facilities can operate their businesses again, and also large-scale cram schools have reopened, strict preventive measures will be in effect at such venues. And also, authorities are calling on citizens to practice basic hygiene measures as well as wear face masks, and stressing that more responsibility is needed with this downgrading of the social distancing measures. And we have been seeing around the world, because of the lifting of restrictions, there have been resurgences. So with that, let's take a look at the global figures. 37.7 million people around the world have been infected, with over 1 million fatalities and some 28.3 million recoveries. Let's move over to the hotspots around the world. The U.S. here closely, almost 8 million cases now, followed by India, which is actually the gap between the U.S. and India is narrowing. And in the meantime, Russia had some 13,600 new infections on Sunday, which marks a record high. Especially the situation is serious in Moscow. Let's move over to other places now. The UK has surpassed 600,000 cases, Iran 500,000 cases, and in the meantime, Saudi Arabia here has surpassed the total figure of cases in Turkey. And those are the figures I have for now, but I'll be back with more updates after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Right, back on the local front, we bring you now details about a high-tech COVID-19 screening center here in the capital city. I have our Jessica Lee waiting on site. Hello, Jessica.
Good afternoon, Sunny.
Jessica, do start by telling us where you are.
Yes, I'm reporting live from Chuseok COVID-19 Screening Center. And this is the first day after having the 3-day-long Hangul Day weekend. And Korea reported 97 new cases today. And that number is relatively stable, actually remaining in double digits. However, health workers are putting a lot of efforts to prepare for a possible situation. So now in Korea, we have about 599 COVID-19 screening centers, and Seocheogu also began the operation of a so-called Untitled or contactless screening center from the 14th of last month. So let's take a look at it. And here there are 6 booths in operation that enables more than 500 testings a day. And as you look at the screen, today, in the morning, we had about 70 testers who visited here. And in this walkthrough screening center, there are lower risks of infection since the whole process from submitting your information for epidemiological investigation to swabbing is done with no contact. And as you can see here, in each room, glove walls or acrylic walls fitted with gloves for collecting samples separate the medical worker from the person getting tested, which means physical contact can be reduced and minimized as well. And by using the microphone and the speaker, you can communicate with each other easily with a much smaller chance of contagion. Okay, so we also have great points of this screening center that once a person is done with the testing, air ventilation system and negative pressure lets inside air flow out of the facility to prevent the infection, and also UV lamps are blasted for 10 minutes for disinfection. Now let's move the way to the waiting room. And this is an area where you can wait until you get your turn after submitting the paper for registration. In this waiting room, as you can see, air sterilizer is equipped as well, and we can see folding doors are installed to prevent the spread of drumlet transmission and also to ventilate the air. So we did take a look at the Seocheogu COVID-19 screening center, and now let's have a talk with the doctor who's currently working here at Seocheogu Screening Center. So good afternoon.
Hello.
So first of all, what are the most unique features of this center?
At such a COVID-19 screening center, all process from registration, epidemiological studies, history taking, and samplings are done by walking through system with no contact between the patient and the medical staff. So the medical staffs are working in a much more safer and comfortable condition without having to wear heavy medical D-level protective equipment.
Yes, I believe that now medical workers here can conduct tests in much easier to wear suits. Thank you for your time today. Thank you. As the coronavirus pandemic continues to rage on, doctors, nurses, and all medical workers are continuing the battle against the virus in front lines. So we should take extra precautionary measures and also follow personal hygiene guidelines to help them in minimizing the burden of our health workers and also to stem the spread of this infectious disease. This has been Jessica Lee reporting live from Seocheogu COVID-19 Screening Center, and back to you, Sunny, in the studio.
All right, Jessica, thank you very much for that coverage. Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular briefing on COVID-19 here in this part of the world. As mentioned earlier, authorities have opted to ease social distancing to level 1 as of this Monday, with the Greater Seoul area witnessing a few exceptions, however. Let's now take a quick look at some of the guidelines in place. Gatherings of more than 50 people indoors and 100 outdoors are allowed, but here in the metropolitan area, they are still being strongly discouraged. But should such gatherings be held, authorities are calling for stringent safety practices and the proper spacing of people. In the academic arena, cram schools of more than 300 people can resume classes starting from today. While come October 19th, that would be next Monday, schools can accommodate 2/3 of their student body at any one time. With regard to high-risk establishments and operations, clubs, bars, singing rooms, as well as buffet restaurants are among the 11 that can resume business, while door-to-door sales activities remain banned. 16 other public-use facilities, such as cafes, ordinary restaurants in the capital region, face tough safety measures while in operation, but those in other regions across the country have less stringent guidelines to follow. Now, the guidelines in question have much to do with the seating arrangements and the spacing of patrons, depending on the size of the establishment. At places of worship, in-person regular sermons are allowed here in the metropolitan area, but small group gatherings and meals are not. Elsewhere in the country, local authorities are being advised to draw up their own regulations depending on their respective situations. At sports stadiums, officials can have 30% of their seats filled with spectators. Government facilities, meanwhile, have a slightly higher capacity cap of 50%. At the workplace, remote working and flex time are being recommended at both public and private entities. Operations at social care centres, including those for children, have started as well. Now, we are still waiting for the briefing to start, and perhaps while we do, we can take a look again at today's figures for Korea. Now, on this Monday, Korea has noted 97 infections, and as Soa mentioned earlier, from those infections, 29 of them are from overseas. Our total number of infections for this Monday here in Korea stands at 24,703. We've lost one life, raising our death toll to 433, while those in quarantine stand at about 1,500, and those fully recovered stands at 22,729. The briefing appears to have been delayed by a few minutes. We are still waiting for it to consume, and perhaps while we do, we can take a few words perhaps with our... Oh, I understand the briefing is about to start. I'll come back to you with a summary of it with our Kwon So-ah later.
First of all, we have Commissioner Chung Eun-kyung with the briefing. Let us now begin our regular briefing for COVID-19 response here in South Korea. As of October 12th, Monday, we have a total of 68 new local infections and 29 new imported cases. The total caseload now stands at 24,703. Currently, we have 1,541 people in quarantine undergoing treatment, and we have a drop in our critically ill cases, standing at 87. And we had one additional fatality with the accumulated death toll standing at 433. I extend my deepest condolences to the deceased and the members of the bereaved family. Let us now take a look at our updates on domestic infections by region. At a funeral in relation to at the Seodaemungu District, Seoul City, we also have additional cases of 10 being confirmed. In total, we have 11 cases being confirmed to date. And in Gyeonggi-do Province, in relation to a friends meeting in Dongducheon area, we have more cases being confirmed. 15 cases have been confirmed to date. And in relation to Sports Island Gym in Gyeonggi-do Province, Suwon City, we also have additional cases being confirmed, of 6 additional cases being confirmed. And in Daejeon City, in relation to a family gathering, we also have the first index case being confirmed earlier this month. We have 13 additional cases, and a total of 14 have been confirmed to date. 7 of them are family members, and also among them, we also have a cluster infection of 7 breaking out at a daycare center. And as for the imported cases, today we have a total of 29 imported cases, which is a slight increase, and 9 have been reported at the points of entry, while the rest of 20 have been reported at self-quarantine, and 24 were foreign nationals. And as for the countries, we have 13 Nepalese who came into Korea, and thus we had a slight increase in the number, and we have 4 from India, Uzbekistan 3, and 2 from the Philippines as well. And looking at the quarantine measures as well as the risk factors for the past week, the domestic infections, we also have about 61.3, which is about 4 cases higher than the previous week. And during the previous week, we had the Chuseok holiday, which is probably why we have a lower number of confirmed cases. And during the past week, we also see new clusters infections being dropped to dropped by 4 from the previous week, which now stands at 9. And we also have under 20% of chain transmissions which are under investigation. And we have also under 80% of the new cases under management. And as for the imported cases, we have about 13 cases on average on a daily basis, which is similar to that of the previous week. And we have seen a slight decrease in our number of fatalities, and we have 10 in total. And also most of them stood at the age group of 80, and also we had one from the 60s and 50s as well. And we also have all of the 10 people having chronic illnesses and underlying illnesses. And looking at the fatalities among the seniors, we have a 21.3% for those over the age of 80, and also which is quite significantly higher than those of other age groups, including those in the 60s and 70s. And during the past week, we have seen the sources of infection. 25%, almost 25% were domestic cluster infections. And also we have 21.1% under investigation currently. And still we have seen, continue to witness cluster infections centering around nursing hospitals and hospitals as well as family gatherings following Chuseok holiday. And we also see door-to-door sales facilities which are being reported as well. During the past week, we've seen also a military garrison, 2 bases in Gyeonggi-do province. The northern area of Gyeonggi-do province have been reported. And we also have a higher number of people in the senior age group who have severe or critical conditions. And this is why we highlight the importance of taking particular precautions at senior facilities as well, including the nursing hospitals and nursing homes. And centering around the metropolitan area, we also would like to take note that all of the people who are working and using the high-risk facilities, we are also seeking a possible way to conduct testing on all of the people who work at these high-risk facilities in the metropolitan area as well. And we also would like to highlight the importance of wearing face masks and keeping a healthy distance and abiding by strict quarantine measures. We have eased the nationwide social distancing level to level 1. However, we would like to continue to highlight the importance of the social distancing level 2 measures partially being put in place in the metropolitan area as well. And as for the public transportation and public rallies and the health clinics and nursing hospitals and nursing homes, we would like to note that wearing face masks is mandatory regardless of the level of the social distancing measures. If one breaches such a measure, we would like to note that these people will be also subject to penalties. And we will have a 1-month period of grace period for this penalty. And we have been able to ease our restrictions and social distancing measures to the lowest level of level 1, thanks to the participation and cooperation by the public. And in order to stem the further infections, we ask you to make it a habit to abide by such quarantine measures. And currently we are witnessing chilly weather, and we need to curb the virus spread of the COVID-19 and influenza outbreak as well. It is very important for us to also take particular precautions as well. And during this week, we would like to announce some measures of the outbreak of the influenza outbreak trend. And we have seen our 4th week of the inspection. And among the 1,000 people who were inpatients to hospitals, we have seen a slight decrease to about 3.6, which is slightly lower than the on-year average. However, we have not yet seen an outbreak of a major influenza outbreak. However, starting from this year, we would like to have a strict and intensified inspection on the influenza outbreak, and we are also disclosing the the results of the analysis. And during the fourth week of our inspection, we have seen as for the respiratory samples, we have separated about 1.9% of these samples so far, and we will conduct continued monitoring as well, and we will disclose the outcome to the public. Currently, we do not have an advisory warning in place for influenza. However, we have seen that in some inpatients and in some respiratory symptoms, people suffering from respiratory symptoms, we have seen that the influenza is being detected in some patients, and we will disclose further results going forward. And tomorrow we will resume our free of charge public vaccination program. And we would like to highlight all of the people to comply with the quarantine measures, including wearing a face mask and washing of your hands. Moreover, in order to ensure a safe environment at hospitals, we ask you to make reservations online previously before you make a visit to the hospitals, and please abide by quarantine measures at these hospitals as well. And when you visit the hospitals, please wear your face mask at all times, and always wash your hands and disinfect your hands with sanitizers as well. And if you have symptoms, please postpone your vaccination and also get tested if necessary. Starting from today, we will be easing. We have eased our social distancing measures to a level 1. And in the metropolitan area, 5 types of high-risk facilities, including clubs, will have to restrict their number of users. And we also ask you to comply with strict measures as well at eateries and coffee shops here in the metropolitan area. The decisions on the easing of these distancing policies were made considering the prolonged fatigue level among the public, as well as the difficulties, the economic difficulties of the small business owners. However, please note that we have about on day we have an average of 50 to 70 daily cases, and we also have incubation period and a possible sporadic outbreak risks as well. So the quarantine authorities would also like to note that we are also put at another type of test, and we have to see if we can protect ourselves securely from the virus, and everything depends on active and proactive participation by the public, as well as inspection by the facility users, as well as the managers. And we believe that this can only enable striking a balance between the routine daily lives and our quarantine measures. So starting a new phase of our social distancing measures, we are highly concerned about a possible complacency that could be witnessed among many people of the citizens. And we believe that the COVID-19, if we stay complacent, will be very detrimental for our health and our economy and for our society as a whole. And we have known, we have been experiencing throughout the past month, we have seen that COVID-19 spreads very fast among confined and crowded places that are poorly ventilated. So if you are going to these crowded places and confined places that are close contact in environment, you can be exposed to the virus at any time and anywhere. And also if we have physical contact, we could also be prone to the virus infections as well, especially if we do not wear face masks. And if we engage in group meals, and also if we engage in singing and chanting, which increases the travel of droplets, we also have increased risks of infection as well. So please wear your face mask and refrain from visiting the confined, crowded, and close contact environment. Second risk factor is probably group activities, especially group hiking and group tour packages using large limousine buses, and as well as group meals that follow. And please, we also advise you to travel safely in family units only. Thirdly, we also see that the environmental factor could also play a big role, and in these environments we would have a long survival of the virus, and we have an increase in our indoor activities, and we could also be complacent in irregular ventilation as well. In confined places, we also see infections spreading through respiratory droplets and have a possible risk of aerosol infection as well. So please ventilate your facilities and spaces on a regular basis and disinfect highly and frequently used surfaces as well. Please note that your solidarity, the solidarity that you have shown during the past months have helped us to ease our social distancing policy levels, and please continue to partake in our measures going forward so that, and also help us, and we would also like to continue our vigilance going forward. Thank you very much.
Right, that was Chung Eun-kyung, the Commissioner of the Korea Disease Control and Prevention Agency, with Monday's afternoon briefing. I have our Kwon Soa with the gist of her address today, Soa.
Well, let's start with the one-week assessment of the government revolving around the situation. First off, it looks like there has been 61.4 cases on average on a daily basis in the past week. That's 4 up from the previous week. And there have been 9 cases of cluster infections. That's down by 4, while there have been 13 imported cases, which is similar from the previous week. And the average death toll stood at 10, and that's also slightly down. In the meantime, as today marks the first day we're back to the social distancing measures at level 1, Chung stressed this decision has been made on the back of the fatigue of the nation's people and also the economic difficulties, which means the pandemic is not over, and that's why she called on the people to continue to properly wear their masks and also abide by basic social distancing measures, and especially when you're at public transportations or medical facilities, as well as during rallies. And to give more responsibility to the people, this is also why the government decided on fees if you do not abide by such measures, but that will begin from a month from now.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
지난 2주 동안 국내 발생 확진자 수는 하루 평균 60명 미만으로 줄었고 감염 재생산 지수도 1 이하로 떨어져 확산세가 억제되고 있다고 하는 판단입니다.
Social distancing has been lowered to level 1 here in Korea as of this Monday. And in today's studio session, we address this latest decision by the government. I have our Professor Chuseok from Hallym University. Welcome back, Professor Chung.
Thank you.
And I also have Dr. Alice Hyung-kyung-tan from Ms. Mary Women's Hospital. Pleasure to have you back, Dr. Tan.
Thank you.
Professor Chung, what are your thoughts on the latest decision by the government to lower the country's social distancing level to level 1? What do you suppose also prompted this particular decision?
I think it's about time to level down the current status, because we see a very stable occurring number for last 2 weeks, and it's well below 100. Even though it doesn't meet the 50, under 50 patients every day, but it's quite stable. And there was no big cluster outbreak since the beginning of October. So I think it's time, but there are some bad figures as well. First of all, infection sources are not identified in about 19% of all cases. That means there are 20% of unconfirmed cases who are very silent and silently spreading the viruses in our neighborhood. So it's a bad thing. And another one is, again, less than 50 is a criteria, but it does not meet the criteria. But the reason why the government is like to level down from 2 to 1.5 or 1 is just to booming up the economy despite the COVID-19 pandemic.
I see. And adding on to the gloomy outlook that Professor Chung has also spoken about, Dr. Tan, it's only been a week since we marked an end to the Chuseok holiday last Sunday, and we're returning from a long weekend to mark Hangul Day. I understand the incubation period of the virus is 14 days, so it's only possible that there would be a rebound in the days to come. What are your thoughts on this?
Well, let's look at what's been happening with COVID-19 in our country historically. Our first wave, the Shincheonji outbreak, the index case had her symptoms start February 7th. That is exactly 14 days since the beginning of the Lunar New Year holiday. Our second wave, the Itaewon cluster, of course, the index case had symptoms and went clubbing over the May Children's Day long weekend. And our last wave, the third wave, started before August 13th, but it was amplified by the Independence Day travel and the protests. So our cases and outbreaks here in Korea really have started and ended with the holidays. We are, as you said, 1 week out of Chuseok, 1 day out of Hangul Day. There's the possibility of stacking of cases that could have occurred. And with the latent period, as you mentioned, I think it's too early really to say that we are out of the woods and that we are safe from this last long holiday that really went for a week and a half. That being said, there is some good news, and the good news is that I think more people are aware and compliant with infectious disease control measures. The bad news, however, is that there has been an uptick in the number of citizen-initiated safety violation reports from the community, and they are all repeats of the kind of outbreaks that we've seen in the past, such as inpatient worship at churches without a mask, people failing to adhere to infectious control measures at nightclubs, at indoor cafes and restaurants, and at internet cafes. And so these are slightly worrying signs, I think. We do need to stay vigilant.
Right, we do. Professor Chung, the effective reproduction number, or the R number of COVID-19 here in Korea, stands at 0.87. Please do correct me if I am wrong. I understand that an R value of 1 is a crucial threshold, and many are working to bring that number down to below 1. We stand right now below 1. Please tell us more about this.
Yes, the number, it always varies. So do not stick to 0.87. It always varies, changes. And it means, as you know, 0.87 means one patient can transmit the disease to a 0.87 person. So that means gradually reducing of infected people in the society. It's very good news. But several months ago, it was anticipated as more than 100 sometimes. So it always varies. And you have to know that several components in that number, reproduction number. First of all, is the viral site, the transmission power of a virus. When the virus is more virulent, then the transmission is more easier. But we cannot handle that. It's GH type. And the other is the host factor, number of contacts of confirmed patients. So if you decrease the number of contacts, then you can reduce the number. And the other one is shedding viruses. But the host, again, cannot handle the shedding the viruses. If you have lots of virus, and then you can shed more than 2 weeks. You have a small amount of virus and you are very immune early, then you can shed only a week or so. So among 3 components, you can handle only the host factor and the number of contacts. That's why the social distancing is very important.
I see. For a better understanding of the situation unfolding here in this part of the world, let's take a moment now to turn to neighboring Japan, where the total number of infections has hit above 90,000. I have Mikihiko Ueno, a journalist, there live on the line. Hello, Mikihiko.
Hello, how are you?
Fine, thank you. Let's begin with the overall COVID-19 situation in Japan then.
Yes, actually, the situation is not really serious right now in Japan. Yes, of course, we have positive patients that are increasing in the Japan, but it's been very slow. And the number of the patients that needs sort of kind of hospitalizations or patients dies from the COVID-19 is very low. Actually, it's a little bit lower than China. And I should say that means that in Japan, even if one person is tested as a positive, he is actually treatable. This is a treatable disease. So I can say that the situation in Japan right now is fairly controlled.
I see. Dr. Tan, I believe you have a question that you would like to ask Mikihiko.
Yes, Mr. Ueno, thank you so much for joining us. I understand that in early August, only 30 of the 47 provinces or prefectures in Japan had adequate testing capacity for COVID-19 in terms of a PCR test. And that prompted the health ministry to really boost testing capacity. The first goal was at least 56,000 tests per day, with the eventual goal of being able to perform 72,000 tests per day to deal with outbreaks and surges. I was wondering if you could tell me, what is the test capacity like in Japan currently, especially the highly populated regions such as Tokyo and Osaka?
Yes, just like Professor Tan said, we have been conducting about 20,000 PCR tests per day right now. It started about around the end of July, and now we have at most 70,000 PCR tests per day. Well, but I have to say that we didn't have actually sufficient PCR kits in the first time of the COVID-19 pandemic, and there were not enough PCR kits. There was not many organizations that can conduct legally conduct PCR tests. And well, I guess one of the main reasons that we couldn't do well in the first time of the pandemic was that we didn't have experienced the SARS or MERS, not like ROK. Yes, and about now, several months has passed since the pandemic, and the problems I said or Professor Tan said is actually almost being solved, and the situation got much better than that time of the pandemic.
I see. Professor Chung, you also have a question for Mikihiko?
My question to Mr. Ueno is, Prime Minister Suga has started his term recently, and do you find any changes in terms of quarantine policy compared with previous Prime Minister Abe Shinzo? I already know that you have allowed business trip to Japan for Koreans.
Okay, as you know, that Prime Minister Suga has been the chief cabinet secretary of the Abe administration. So I guess that the basic idea that Prime Minister Suga has about the COVID-19 is almost the same as that of the Prime Minister Abe. And however, the situation has a little bit changed. And from my point of view, Prime Minister Suga is using his more power on reconstructing the economy. You know, for example, the government started a campaign that compensates our sort of accommodation fee or restaurant fee when we go for a travel. It compensates about 30 or 40%. That is actually really good for us. And the purpose of this campaign is, of course, to stimulate the consumption and to activate the domestic economy. This is what Suga is thinking about. And the other one is, the professor just said that we started business travel without 2 weeks isolations. It started the 8th of this month. So Prime Minister Suga is also thinking about the stimulate our economy by from the foreign countries. This is what Prime Minister is thinking right now.
I see. And staying with that, Mikihiko, I was going to actually ask you about the travel that Professor Chung had mentioned. So business travel has resumed between the two countries. What impact do you suppose this new measure will have on bilateral ties?
Okay. Well, actually, I am a journalist of the political news section, so I think this is politically one reason that our government started this this business trip is one reason is to get ready for the Olympic Games next year. Of course, I don't know if the Olympic Games is going to come true next year, but anyway, we have to start to prepare to accept people from foreign countries, and at the same time, we have to start appealing that Japan is a safe country. This is one reason. And the other reason, I guess, is, of course, it's going to be a good message for ROK. You know what I mean? That of course, Prime Minister Suga has actually the same idea with same as Prime Minister Abe towards ROK, especially in regards to the historic issues. However, nevertheless, his idea, he started business travel with ROK. So this means that one is that Prime Minister Suga thinks economy of the ROK is very important for our economy, and the other reason is actually I could say it's a hidden message that Prime Minister Suga has a will to do something with in regards to the bilateral relation between Japan and ROK, and maybe at least I think he is ready to talk with ROK or maybe President Moon Jae-in.
I see. All right, Mikihiko, thank you very much for making the time to join us live at this particular hour.
Thank you very much.
Thank you. Right, Dr. Dan, we'll go back to the situation here in the country, but first I ask you, research shows that heart conditions can occur within patients of COVID-19. Can you tell us a bit about this briefly?
Right. So although COVID-19 is primarily spread by respiratory route or through contact, many patients have had multi-organ system involvement. In other words, multiple organs in the body can be involved, including the brain and nerves, the lungs, the liver, kidneys, the gut, the heart, and the blood vessels. And those last two, the heart and blood vessels, make up the cardiovascular system. In terms of the mechanism of why we think this is happening, there are four potential causes. The first is direct viral invasion of the heart muscles and the blood vessels, and that's through the ACE2 receptor. That is the target for the virus spike protein in humans. The second is through inflammation. When we have inflammation of the heart, that's called myocarditis. Of the blood vessels, that's called vasculitis. The third is potentially blood clots, especially very small blood clots called microemboli. And in autopsy studies, they have found blood clots in many of the blood vessels of the body, including those of the heart. And lastly, we're not exactly sure how it works, but the fat surrounding the heart, that's called the epicardial adipose tissue, that may be serving as a reservoir or sort of a hiding place for the virus. And so after the initial infection, the virus might be able to come out again from that fat tissue and cause more damage. The bottom line is that these mechanisms can cause decreased heart function, and if it involves the electrical circuitry of the heart, irregularities in the heartbeat as well, arrhythmia. And so that's why many scientific medical communities are recommending close follow-up of patients who have evidence of heart damage. That would include an EKG and an echocardiogram, that's a sonogram of the heart, at least 2 months after recovery from COVID-19, possibly even 6 months after recovery.
I see. In a silver lining of sorts, Professor Chung, I hear that there's been a decline in other illnesses such as the common flu and influenza, given the practice of personal hygiene by the public. Is this true?
Yes, it's quite right. That's why when I was working as a director of KCDC, we kept asking people to wear masks sometimes when you have an infected agent, and washing hands always. but washing hands thoroughly for at least 30 seconds. And cover your mouth with sleeves, or if you have handkerchief or a tissue, you have to cover your mouth to prevent your infectious agent coming out from mouth. So washing hands and wearing masks and cough etiquette are the mainstay in preventing any kind of infectious disease. So these days, the pediatricians, pulmonologists like myself, and ENT doctors are seeing less and less patients than before, all because of personal hygiene thing.
I see the washing of hands, the covering of our mouths when we're coughing, and maybe the wearing of masks, of course. Dr. Dan, I'm going to use a jargon now. Povidone iodine. It's a topical antiseptic that provides infection protection against minor cuts or burns, scrapes. I remember seeing this at home as well. Now, I believe there's been research that shows that this antiseptic can inactivate the coronavirus. Please tell us more.
Yes, so that's true, but the caveat is that it's acting as an antiviral medicine against SARS-CoV-2 in laboratory settings. So the results have shown very impressive, actually impressive antiviral, so viral killing activity, but it's all been in vitro, in a test tube, in a petri dish. We have yet to see any studies that show that povidone iodine can be helpful in either prevention or treatment of COVID-19. So it's definitely not time yet to gargle with it or to swallow it or to think in any way, shape, or form that it can help prevent COVID-19.
Right, it's too early then.
It's too early, but it is a very interesting finding.
I see. Professor Chung, one final question, very briefly speaking. We had the Commissioner, Chung Young, talking about the importance of wearing masks. Tougher mask mandates are poised to go into effect, of course, but we are told that certain masks, like the ones with the valves or the vents to make breathing easier, are banned. Please tell us why.
Yes, the bell mask is very effective to prevent the droplet to come to your mouth and your nose. But it can easily blow out your droplet to the air. So that's why the CDC has prevented using that kind of bell mask.
I see. So essentially it only protects the wearer.
Yeah.
I see. All right, Professor Chung, as always, thank you for your thoughts. And Dr. Tan, as always, thank you for being with us today.
Thank you.
Right, well, that brings us to the end of Monday's coverage. Do join us again tomorrow at this hour as we take another look at the current treatment options for COVID-19, including those used on US President Donald Trump and more. In the meantime, do take care and thank you for watching.